All right, so we're prepping for a nuclear medicine radiographer interview.
Exciting stuff.
It is exciting, and we've got a stack of RoleCatcher resources to help us really get into it.
Yeah.
Um, career guides, interview guides, and even AI insights to kind of fine-tune our answers.
Yeah. I think it's important to remember, it's not just about what you know, but how you think and how you approach challenges.
Right, exactly.
And that's what these resources are all about.
Yeah, so this deep dive that we're doing today is all about showcasing that.
Absolutely.
So let's get into it.
Okay.
First things first.
Yeah.
What is a nuclear medicine radiographer?
Right. So basically, they are medical professionals who use radioactive materials to help diagnose and treat patients.
Yep.
And the cool thing about this field is that they use a variety of imaging techniques.
Oh, wow.
So we're talking X-rays, MRI, and even radiopharmaceuticals.
So it's like cutting-edge technology meets patient care.
Absolutely. It's a really dynamic field.
Wow. Okay, so landing that interview, RoleCatcher's AI is like the secret weapon, I feel like.
It can be a really useful tool.
Right, because it analyzes job descriptions.
Right?
And it can see where your resume shines and where you can boost your score for those applicant tracking systems.
Yeah. Those systems can be a real pain.
Oh, yeah.
It's like sometimes you submit your resume and it just disappears into the void.
You get like the thanks but no thanks email and you're like, wait!
Exactly. And so this AI can help you kind of get past that initial screening and actually get your resume in front of a human being.
I like that. So it helps you dodge the no pile.
Exactly.
Okay, so now onto the hot seat, the interview questions.
Okay, let's do it.
We're going to tackle the top 10, but I think just for the sake of time, maybe let's hit some of the ones that people might find really tricky.
Sounds good.
Okay, so question number 1.
All right.
What inspired you to pursue this career?
Oh, that's a classic.
It is a classic, and it's so tempting to just be like, oh, I like science.
Right, or I like helping people.
Yeah, exactly.
But you really need to go deeper than that.
I think so, too, because they want to know, like, what is your unique story?
Exactly what makes you tick. What led you to this specific field?
Right. And RoleCatcher has some sample answers in there.
They do.
Which are great, but I think it's really key to make it personal.
Absolutely. You need to make it your own.
Yeah. So was there a specific moment that kind of sparked your interest?
Right. Was there a family member who had an experience, or maybe you saw a documentary that just fascinated you?
Oh, or even a high school science project.
Totally. Yeah. Anything that really got you hooked.
Yeah.
And think about why this field matters to you. Is it the technology? Is it the problem-solving aspect? Is it the patient care?
I think it's usually a combo.
Yeah, often it is.
But I think, like, finding that why
Yes.
is what will make your answer stand out.
It will make you memorable. It will show that you're genuinely passionate about this field.
And they can see if you're being genuine.
Absolutely.
Okay, so question number 2. How do you ensure patient safety during nuclear medicine procedures?
Okay, so this is a big one because patient safety is paramount in this field.
Right, and it's not just about listing protocols.
Right.
It's about demonstrating that commitment to going above and beyond.
Exactly. So you could mention specific protocols from the guide, things like shielding,
Right.
monitoring radiation exposure.
Yeah.
But then think about a time when you went above and beyond for a patient's well-being.
Okay, so give a specific example.
Exactly. Did you ever catch a potential error? Or maybe you noticed that a patient seemed particularly anxious and you took extra steps to make them feel more comfortable.
I like that.
Yeah, those details really bring your answer to life.
Okay, let's skip ahead a little bit.
Yeah.
I think number 7, how do you ensure effective communication with other members of the healthcare team? This one's all about teamwork.
It is, and it's not just about talking.
Oh.
It's also about listening
Oh,
and understanding different perspectives.
okay.
So think about a time when you had to bridge a communication gap between colleagues.
Okay, so a real-world example.
Exactly, because that shows that you can actually apply these skills in a real setting.
And I think that's something that they're really looking for is, can you apply what you know
Absolutely.
to real-life situations?
Yep.
Okay, one more. Let's do question number 10.
Okay.
Troubleshooting equipment issues.
Ah, yes.
Deep breaths.
Deep breaths. It happens.
It does happen.
Equipment malfunctions.
And it's all about how you problem solve.
Exactly. So what's your process when something goes wrong?
Yeah.
Do you panic or do you have a systematic approach?
Right.
So RoleCatcher mentions adjusting imaging parameters.
Okay.
Have you ever had to do that?
Good question.
Because that shows that you have the technical skills to actually address these issues.
Right, and that you can think on your feet.
Exactly.
Okay, so beyond these questions, which we've kind of skimmed over
You have.
a little bit,
Yeah.
I think RoleCatcher also has a lot of good career insights.
It does.
That I think would be really impressive to mention in the interview. So, for example, did you know that there are specializations within nuclear medicine?
I didn't know that.
I didn't either until I looked at RoleCatcher.
That's so cool.
So you could focus on cardiology, you could do PET imaging.
Wow, so many options.
So many options. So if you have any kind of interest in a specific area, that's something to look into.
Definitely.
And then also advancement paths.
Oh, yeah.
So you could become a supervisor, you could specialize further, or even contribute to research.
So you're not just stuck in one role for your entire career.
Yeah, there's room for growth.
Exactly.
And then I think this is important to mention too, are certifications.
Oh, yeah. Those are important.
So there's the CNMT, RT, Nuclear Medicine, BLS. Those all add weight to your resume.
Yeah, they show that you're committed to professional development.
Right, and that you've gone the extra mile to really hone your skills.
Absolutely.
And I think one thing that's really cool about RoleCatcher is that its AI can actually give you personalized feedback on your answers.
Oh, wow.
So you can practice and refine your responses.
That's so helpful.
It is, because practice makes perfect.
Absolutely.
So you can go into that interview feeling really confident.
Yeah, like you've got this.
Exactly.
Okay, so, we were just talking about effective communication.
Yeah.
And how important it is to be able to understand different perspectives.
Yeah, and I think, in those clinical rotations, you really see that firsthand.
Absolutely.
Working with nurses, physicians, everybody's got their own way of doing things.
Exactly. And that kind of leads us into our next question, which is all about patient care.
Okay.
How do you ensure patient comfort during nuclear medicine procedures?
Oh, that's a good one, because, some of these procedures can be a little intimidating for patients.
Definitely.
Especially if they have to stay still for a long time.
Right. Or if it involves needles or injections.
Oh, yeah.
People get nervous.
Absolutely.
So it's really important to be able to put them at ease.
Right. So I guess this question is about more than just technical expertise.
Absolutely. It's about empathy and compassion.
And just making that connection with the patient.
Exactly.
So what are some things that you can do to make sure that the patient is comfortable?
Well, it could be something as simple as offering them a warm blanket.
Oh, that's a good one.
Or explaining the procedure in a way that they can understand, and that helps to calm their nerves.
Right, like putting it in layman's terms.
Exactly. And sometimes it's just about engaging in some friendly conversation.
Oh, yeah, just to take their mind off of things.
Exactly.
I like that.
And, the RoleCatcher Career Guide actually emphasizes the importance of patient communication and education.
Oh, really?
Yeah, it mentions that clearly explaining procedures and answering questions thoroughly can really help to reduce anxiety.
Oh, that makes sense.
It's all about empowering the patient to feel like they're involved in their care.
I like that.
And feeling more in control of the situation.
Right, and informed decisions.
Exactly, and sometimes comfort goes beyond just physical well-being.
Oh, okay.
It's also about ensuring their privacy and confidentiality.
Right, which is super important.
Absolutely, and that brings us to question number 9.
Okay.
How do you ensure patient confidentiality and privacy during nuclear medicine procedures?
This is a big one.
It is a big one, and it's not just about saying HIPAA.
Right. You got to go deeper than that.
Exactly. You need to demonstrate that you understand the sensitivity of medical information.
And that you take concrete steps to protect it.
Right. So the guide mentions things like secure data storage.
Right.
And obtaining consent before sharing information.
Yeah.
But it also emphasizes the importance of being discreet and respectful in all patient interactions.
Oh, okay. So it's not just about the policies. It's about your overall demeanor.
Exactly. It's about being mindful of how you discuss patient cases, even in casual conversations with colleagues.
Right. So like not gossiping about patients in the break room.
Exactly. And it's also about ensuring that patients are properly covered and their dignity is maintained throughout the procedure.
Right. Because they might be in a vulnerable position.
They are, and it's our job to make them feel as comfortable and respected as possible.
Okay, I like that.
So those subtle actions really speak volumes about your professionalism and your commitment to ethical care.
Right. It shows that you really care.
Exactly.
Okay, are you ready for the final question?
Hit me with it.
All right, here we go. Can you describe a time when you had to troubleshoot equipment or resolve technical issues during a nuclear medicine procedure?
Ooh, that's a tough one.
It is a tough one, but it's a good opportunity to show off your problem-solving skills.
Absolutely, because let's face it, equipment malfunctions happen.
Oh, yeah, they do.
And in the middle of a procedure, that can be stressful.
Absolutely.
So it's all about showing that you can stay calm under pressure.
And think critically
Exactly.
to find a solution.
So you don't have to have encountered every possible problem.
Right.
It's more about showcasing your approach.
Okay, so like what are the steps that you take when something goes wrong?
Right. Do you consult the equipment manual? Do you reach out to a more experienced colleague for guidance?
Right.
What do you do?
And I think this is where RoleCatcher's AI can really come in handy,
How so?
because it can help you frame your response
Hmm.
based on the specific skills mentioned in the job description.
Oh, that's smart.
So like, if the job description emphasizes technical proficiency,
Right.
you can really focus on how you systematically troubleshoot equipment issues.
Okay.
But if it's more about teamwork,
Right.
you might want to highlight how you collaborated with others to resolve the problem.
That makes sense. So you're tailoring your response to what the employer is looking for.
Exactly.
That's a good tip.
So thinking back on your experience, have you ever had to get creative to find a workaround when a piece of equipment malfunctioned?
Oh, yeah, definitely. There was this one time.
Oh, tell me about it.
Well, it was during a really critical procedure, and the scanner just decided to stop working.
Oh, no.
And we were in the middle of imaging a patient.
So what did you do?
Well, I tried restarting the system,
Of course.
but that didn't work.
So I checked the error logs, and I noticed that there was a problem with the detector.
Oh, wow.
So I contacted the manufacturer's technical support line,
Okay.
and they walked me through some troubleshooting steps.
And were you able to fix it?
Luckily, yes.
Oh, good.
It turned out to be a loose connection.
Oh, wow. So simple.
I know, but sometimes it's the simplest things that cause the biggest problems.
It's so true.
But you know what? That experience really taught me the importance of staying calm under pressure
Absolutely.
and thinking logically to solve problems.
Right. And it also highlighted the importance of preventative maintenance.
Oh, yeah, because if you can catch those small issues before they become big problems.
Exactly. You can avoid a lot of headaches.
I like it, preventative maintenance.
Preventative maintenance is key.
Okay, so we focused on these 10 specific questions,
We have.
but RoleCatcher's resources go beyond interview prep.
Oh, yeah.
And I was looking at the career guide, and it dives into some really interesting aspects of nuclear medicine,
Like what?
like specializations.
Oh.
So you could focus on cardiac nuclear medicine,
Oh, wow.
where you'd be using imaging techniques to diagnose and monitor heart conditions.
That sounds fascinating.
It does, and I think, if you have a particular interest in cardiology, that could be a really rewarding path.
Definitely.
So tell me more about cardiac nuclear medicine.
Well, basically, it involves using radioactive tracers to visualize blood flow through the heart.
Okay.
And that allows us to identify areas of damage.
Oh, wow.
So, for example, if a patient has had a heart attack,
Right?
we can use cardiac nuclear medicine to see which parts of the heart muscle are not getting enough blood flow.
And that helps to guide treatment decisions.
Exactly.
Wow, that's incredible.
It's a really powerful tool.
So within this field, you can really focus on an area that aligns with your interests and your strengths.
Absolutely.
And it's not just about personal fulfillment.
Right.
Specializing can also open up new career paths and leadership opportunities.
So, for instance, you could become a supervisor of a cardiac imaging department.
How about-
Or you could even contribute to research in the field.
So there's room for growth.
Absolutely.
Speaking of career advancement,
Yes.
RoleCatcher also mentions certifications,
Oh, right.
like the CNMT.
Certified Nuclear Medicine Technologist?
Yes,
That's a big one.
it is. And it sounds like it can really add weight to your resume.
Definitely, it shows employers that you've met certain standards of competency.
Right, and that you're committed to professional development.
Exactly.
And there's also the RT nuclear medicine.
Right. Registered Technologist in Nuclear Medicine.
Yes. So it's all about stacking those credentials
Absolutely.
and demonstrating that you're serious about your career.
And let's not forget the importance of basic life support certification.
DLS.
Yes, because even though it's not specific to nuclear medicine,
Right.
it shows that you're prepared to handle emergencies.
And that you're committed to patient safety.
Exactly.
So I think even if you're just starting out in your career,
Yeah.
it's crucial to start thinking about those long-term goals.
Absolutely.
And the steps that you can take to achieve them.
And remember, this field is constantly evolving.
Oh, yeah.
So you need to embrace continuous learning.
Right. Always be growing.
Exactly.
I feel like we really dug deep today.
We covered a lot of ground.
Like from those tough interview questions
Right.
to those cool career paths.
Yeah, it's exciting stuff.
It is. And nuclear medicine really seems like it offers so much
It does.
for growth and making a difference.
Absolutely.
So hopefully this deep dive has been helpful.
Yeah, I think we've unpacked a lot of those resources.
Yeah, and shared some valuable insights.
Definitely.
So, you go into that interview Feeling confident and prepared.
Exactly, and excited about the possibilities,
Right.
because this is just the beginning.
Yes, this is just the beginning.
Lifting the job is great,
Right.
but it's what comes next that's even more exciting.
So true.
You know, nuclear medicine is constantly evolving,
It's true.
pushing those boundaries
Yeah.
of what's possible in healthcare.
I mean, think about it. You're going to be working with like the latest technology,
Right.
seeing new imaging techniques and therapeutic applications being developed.
It's really remarkable, the potential for innovation in this field.
It is, and that's what's so inspiring about it.
Absolutely.
You know, we talked about specializations and certifications and advancement,
Right.
but I think what really fuels passion in this field
Yeah.
is that desire to keep learning
Yes.
and to contribute to something bigger.
Absolutely, to make a difference.
Exactly, and I think that's what'll make you stand out.
Yeah, not just in the interview, but throughout your entire career.
For sure.
So as you prepare for that interview,
Yeah.
let that enthusiasm shine through.
I want to see it.
Exactly. Let the interviewers see your genuine interest.
Yes.
And your eagerness to embrace the challenges and the rewards.
And speaking of resources,
Yes.
don't forget RoleCatcher.
Right.
Its AI tools can help you with so much,
It really can.
from fine-tuning your resume
Right.
to practicing those answers, and even receiving personalized feedback for specific job roles.
It's like having a coach in your corner.
I love that analogy.
It's true, though.
It is.
It's like having someone there to guide you through the process.
Okay, so to wrap things up,
Yes.
as you gear up for that interview,
Mm-hmm.
remember you've got the knowledge, the skills, and the passion to excel in this field.
Absolutely.
So embrace the challenge, trust in your preparation,
Right?
and most importantly, believe in yourself.
Believe in yourself.
And never stop exploring and learning and pushing those boundaries.
The future of healthcare needs passionate individuals like you.
That's right. Go out there and make your mark.
We're cheering you on.
Good luck.